Three, two, one. Welcome to the Together We Talk podcast with your host, Rosendale resident and community influencer, Mr. Ken Masser.
Good morning, everybody, and welcome to our Together We Talk podcast. We're here this morning with Dr. Zeenat Sykes. Hello, Zeenat. How are you?
Hi. Yeah, I'm well, thank you.
Thank you very much for joining us. Today, we're going to be talking all about sleep and trying to pick up people's questions and just have a chat really about problems with sleep and how we can sleep more effectively. And obviously, it's a really important thing. So thank you for being with us. Do you want to just take a couple of minutes to introduce yourself, and then we'll start off with some of the questions?
Yeah, so my name's Zeenat Sykes, so I'm a GP at Ilex View Practice in Rawtenstall. I've been working there for 12 years. I've been a doctor for 22 years. I've worked in various places. I'm actually from Rosendale originally. I grew up in Helmshaw. My parents still live in Helmshaw. So Rosendale is dear to my heart. I don't live there anymore. I live in Padiham, but Rosendale dear to my heart. And I work at the vaccine centre. Yesterday I was there and stuff. So, and sleep is something that I'm quite passionate about. And it's actually my husband that got me into learning about sleep. He's not a doctor, but he's been reading some books about sleep. And actually I thought, no, I need to know, because sleep is such a common thing that patients come to see us about at different times of their life and stuff. So I think it's so important. And now there's so much more information about sleep that hopefully I want to kind of pass over to people.
Great. Well, thank you very much for joining us. And so the format for today, we've got a few questions that have been submitted in advance that we're going to run through. We'll do our overrated and underrated segment somewhere in the middle, and then finish off with a few questions after that. So we'll just start off, Zeenat. Could you just tell us a little bit about kind of what is the recommended amounts of sleep for children and adults?
Yeah, so it varies, obviously. So children, obviously babies, young babies need a lot of sleep. And, people who have children will know, babies need like 12 to 16 hours of sleep. I mean, you'll know babies sleep all day long. As children get older, obviously they need less. But say a 3 to 5 year old still needs about 10 to 13 hours of sleep. So, you need to get them to bed early, and they should hopefully sleep all through the night. Teenager is a different entity. Obviously, teenagers' body clock shifts. I have a teenager, 16-year-old, and she's still asleep at the moment. So teenagers still need a good 9 to 12 hours, but their like rhythm has sort of changed. And adults need at least 7 to 9 hours. But we reckon, you really should be trying to at least aim for 8, really. People can function on less sleep, people can function on more sleep, adults. But I'd say try and aim for 8 as an adult, really.
Okay, so that's interesting, because I guess a lot of people sleep less than 8 hours with.
Yeah. So I think nowadays, and I know some famous people like Margaret Thatcher was very well known to only sleep for like a few hours a day. So is Ronald Reagan, her counterpart in America. But actually that is not good for you, and I think they both died of dementia. And I think that you might function well, but long term, I think it's not good for you to sleep so little. Also, it's a quality of sleep. It's not just the length of how many hours you sleep, is you need to have a good quality of sleep as well.
So it's an interesting point that about the quality of sleep. I've got one of these Fitbit sleep tracker things that will say how many hours of light sleep and deep sleep I've had, and I don't know much about it. When you talk about good quality sleep, what does that mean?
Yeah, so sleep, in sleep we have different cycles of sleep. So with sleep, when you first go off to sleep, you're in very light sleep and you can still hear things and stuff. And then as sleep goes on, you go into deeper sleep. You have, I don't want to get too technical, you have non-REM sleep, rapid eye movement sleep, and then you have REM sleep. So you go through this cycle. REM sleep, rapid eye movement, so your eyes would be like moving, is the deep sleep. So that's the sleep that you're really aiming for. And in that sleep, you're not moving, your body is like, still, and that's what is picked up on the trackers and stuff. So Fitbit apps and Garmin, there's various different ones, they are picking up body movement. So they're not really picking up actual sleep. Actual sleep could only be picked up in a lab, when you have your brain waves checked and stuff, but that, you know, it's very difficult. People don't get that done, and they have significant sleep problems, so they're picking up movement. But it's a good gauge kind of thing about, you know, whether you're, you know, if in the morning, if you wake up and you think, oh God, I didn't sleep last night, and you were like really restless and stuff, then you probably didn't get good quality sleep. You might have been asleep, but you've been moving about, so you've not had that REM sleep where you're not moving and stuff. So yeah, so they give you a good indication, I think, but not the actual quality of sleep, if you know what I mean.
That's interesting. I think we've probably all experienced those nights where you might have been in bed for 8, 9, 10, 11 hours, but you wake up still feeling just not very refreshed.
Yeah. So I think that's what we're aiming for, is to get a good length of sleep as well as a good quality of sleep as well.
And what are some of the factors, do you think, that would impact on our quality of sleep? What are some of the things that we should be thinking about?
So I think the big things are caffeine. So caffeine, you know, it's very well known that caffeine affects sleep. So I think, you know, a lot of us, I mean, I'm like a massive teaaholic. If anyone in my office knows me, there's always a cup of tea on my desk, half cold, obviously. I don't have time to drink it. So caffeine is a big thing. So you really, like, the half-life of caffeine is really long. So if you have a cup of coffee in the morning, by 12 hours, it's probably still in your system. Half of it is still in your system at the end of the day, at 12 hours later. So the half-life of caffeine is really long. So cutting down your caffeine, but obviously don't do it all of a sudden, because with caffeine, if you suddenly stop, you will start getting headaches. So you need to wean off the caffeine gradually. So, but decaf tea, you know, my husband drinks decaf tea at home, and sometimes, like, we'll make a caffeinated coffee and a tea and a non-caffeinated, and it's hard to tell the difference sometimes. So, and it tastes pretty good, you know, and coffee's the same. You won't get that buzz that you do with coffee, but reducing that gradually is really important. And even like gradually cutting it out altogether would be a good thing as well. So that will help your quality of sleep. Also, alcohol is a big thing, because alcohol is a stimulant to your body. So I think weaning, you know, reducing your alcohol intake. I think and if you are going to be drinking alcohol, have it earlier in the day. Obviously not when you're at work and stuff, but on the weekends and stuff, have it earlier in the day. So when you're going to bed at night, there's not much alcohol in your system. So, you know, so I think that's an important thing to do as well. Exercise is really important, but not exercising late at night. I think exercising earlier in the day, so that, you know, something where your heart rate's, you know, cardiovascular, you know, cardio exercise is good, but not, you know, like in the 2 hours before you go to bed. You need to do it earlier on, really. So they're just 3 big things that are really important to help you sleep, you know, increase your quality of sleep, really. So they're just simple things, but there's loads of other things as well. If you want me to talk about that, or I can talk about it later.
Yeah, well, I might come on to it later. So reduce your caffeine, drink less alcohol, and try to exercise regularly, but not straight before bed.
Yeah.
Those are really good tips. So just thinking about then problems with sleep, I think people refer to insomnia, this sense of not being able to get to sleep. Is that something that's common? You know, often when you go online late at night, you can see lots of other people.
Yes, yeah. I mean, it's very common. I think they say 1 in 3 adults probably don't sleep at some point, you know, and it's so common. And so probably going online is the worst thing to do in the middle of the night.
Yep.
So insomnia can be various things. So insomnia can be you can't get to sleep. So that can be that you just can't get yourself to sleep. It can be waking up in the night frequently. I mean, waking up in the night a lot, early morning waking also, it can be a symptom of anxiety, of depression, things like that. So if you feel that you have got significant problems with waking up in the night, maybe speak to your doctor or healthcare professional about that. I mean, we all do that in times of worry and stress. We're thinking about things that have happened in the day, and, you know, things you've said to people, or problems at work and stuff like that. So I think, you know, that can be a big thing, but sometimes those things can be temporary and they'll move on and stuff. And then the other thing also is being awake for a long time in the night it can be a problem, you know, and this is when you feel in the morning you've not slept. So sometimes they say if you've been awake for more than 20 minutes, because you don't want to associate your bed with a place of not sleeping. So you actually need to get up, go somewhere quiet, like go downstairs, go to another room, maybe read a book, maybe even watch some TV, listen to some music quietly. And then when you start feeling sleepy, then go back to bed. So don't stay in bed not sleeping, because then when you start going to bed the following days, you'll think, I'm not going to sleep, I'm not going to sleep. And then that is a vicious circle, I think. So I think just getting out of that space and then going back afterwards.
It's a really useful and interesting tip. I've not heard that before, but it makes sense from that kind of psychological perspective, that you don't want to create that association between lying in bed and being awake.
Yeah, and it's a big problem for lots of people, and they, particularly people on sleeping tablets and stuff, they think if they don't have it, they're not going to sleep, and then they associate bed with not sleeping and all that kind of stuff. So it's that the best thing is just get out of that space and come back afterwards feeling sleepy.
Yeah, great, thank you. We've had a question come in that's probably linked to that, just around if my children are not sleeping, have we got any advice for helping children get to sleep?
Yeah, so it's very similar to what for adults, really. I mean, obviously children hopefully aren't drinking alcohol and all that kind of stuff. Exercising is important for children. They need to be active in the daytime. So I mean, it's been difficult with all the homeschooling and stuff because they've had a lot of screen time. They've been sitting at home. PE hasn't been such a thing, and as big a thing. So I think being active in the day for children, they actually say they should have at least 60 minutes of activity a day during the day, outside as well. So it's important. The other big thing is being able to get outside and seeing the daylight and the sunshine when we have some during the day, for adults and for children, so that you should be exposed to sunlight and things during the daytime. Again, with children having the same, like really screen time is so bad, so particularly in bedrooms, not having TVs in bedrooms, limiting screen time before bed, really avoid it for the last couple of hours before they go to sleep is important. Have a healthy diet, that sort of thing. So I think they're the big things really for children, I would say. But being active is the big thing for children, really. And caffeine, children, it's not ideal to give children caffeine like Coca-Cola and stuff like that. So I'd avoid caffeine in children as well.
Great, thank you. Okay, we're going to take a little pause to do our feature, our overrated and underrated. Now, it's important to say that whilst you're a GP, Zeenat, these are some, we've got some kind of fads and some ideas, and so this is going to be your personal view, not a scientific.
Yeah, exactly. Yeah.
But hopefully we'll have a little bit of fun with it. So I'm just going to share my screen here so that people online are able to see, and hopefully you can see them too. So you can see that now?
Yeah.
Okay, so the first one, weighted blankets, overrated or underrated?
I think the jury's out really about weighted blankets. So I don't know if many people know about weighted blankets. So the idea of weighted blankets is it's a blanket that's quite heavy, and it's so it depends on your weight, your own weight and age and stuff. They are used a lot. I mean, recently I had to kind of say, for children with autism, they often do get them for children and behavioural problems, ADHD sometimes, weighted blankets. I think it's debatable. I think it's supposed to trigger off pressure, a bit like kind of pressure points and deep pressure kind of things, to help increase the level of hormones in your brain that can make you help anxiety, and they're talking about it for pain relief and stuff. So I think it's debatable, but I think in certain groups like autistic children and things, I think they are used and they can be beneficial. It's better than having medicating these people and stuff. So I think it can be beneficial, but I think it's a new thing. The jury's out, I would say, but I think it can be beneficial for some people, I think. So it's difficult to know. I'd say underrated maybe, but I'm not sure.
Okay. Sleep sprays. I don't know much about these, but would you say those are overrated or underrated?
I'd probably say overrated. I mean, I've tried one of these. This works one. I think I got a free sample of it and things once. I think the idea is it calms you down with the aromatherapy. I think lavender is in a lot of these sprays, and I think they can help more. The fragrance can calm you. Whether they get you to sleep and whether they keep you asleep is another thing. They smell nice and stuff. So I'd say overrated. You know, I wouldn't waste a lot of money on them, really. But I think they may have a bit of a placebo effect, maybe.
Okay. Sleep supplements.
Yeah, so sleep supplements are interesting. I mean, melatonin, in England, we can't buy melatonin over the counter. We do prescribe it to children with, or GPs don't prescribe it, hospitals, community paediatricians prescribe it to children with autism and things, because they often have sleep cycle problems and stuff. And it's safe in children. It's debatable. I mean, I often buy melatonin when I go to America and I come back for jet lag, and it sort of helps for a couple of days for jet lag. I think long term, what melatonin is, if people don't know, is melatonin is a hormone your brain produces when it gets dark, and it kind of says to your brain it's time to go to sleep. So again, it may help you go to sleep, but it won't necessarily keep you in sleep, and it won't necessarily affect your quality of sleep. So it's okay. I think again, with any of these things, it can cause, you can get used to it and it may stop working. So it's not really for long-term use. Maybe for jet lag, it's okay. I think it does work, but it's not, I'd say they're a little bit overrated, I would say. They may help a bit. The other supplements I think people are taking nowadays, there's valerian root, which is a natural thing. Again, I'd say that's debatable. You still have to check whether they doesn't interact with other medication, because you need to speak to your pharmacist about that. The other big one nowadays people are talking about is a type of magnesium, because magnesium helps relaxation of your muscles and stuff. You have to again check with your pharmacist whether it's safe. They may have some placebo effects, I think, but I think there's not been enough data and studies to say that yes, it's a definite thing to take. So I'll sit on the fence with those, I think.
Okay. Exercising, overrated or underrated?
I think exercise is totally underrated. I think it's really good to exercise in the daytime to help you, not just for sleeping, but for cardiovascular benefits, for mental health. So I think exercise is really important. And if you can't, I can't run marathons or anything and stuff, but even just walking, you need to it gets you out in the fresh air, so you can exercise at home and stuff, but I think exercise outdoors is particularly useful. So it kind of goes with what Phil was saying last week about exercise. So I think it's really important. Even just a brisk walk, even if it's just for a short time, 10 minutes, do whatever you can do. But I think for sleep, I think it's really important.
Yeah, and we've had a comment on Facebook. Charlotte's mentioned that she's had insomnia for a number of years, but that exercise really helps. It's been tough over the last 12 months with gyms and different facilities closed.
It's really important.
Yeah, cool. Sleeping apps, trackers, Fitbits, wearables, overrated?
Yeah, we mentioned those a little bit briefly. I think they're not bad. I think there's loads of different kinds. I wouldn't spend some are like ridiculously expensive, so I wouldn't spend anything crazy on them. I think they give you an indication of sleep. Like we said, they're not actually monitoring your sleep, they're monitoring your movement in bed. So they're okay. They'll give you an indication of when you're moving around and when you've not had a good sleep and things. But then, but also some of the sleep apps also do other things as well, like your heart rate, your oxygen level, one of them does. They can check for condition called atrial fibrillation. The Apple Watch can do that and things. So I think they're not bad. I think that it is interesting, and it actually gets you thinking about sleep a bit more, I think, which I think is a good thing. Was often before we didn't even think about it really. So I think they're not bad. So I think, and they may improve over the years, I hope.
Okay. That's essentially sticking on the fence there a little bit as to whether you
I used to wear one, but I don't know, I wasn't so sure, but I think, some are better than others, I think. So I think, but they're not bad. I think they give you a good indication. They let you take ownership for your sleep, and you could see if things you do make it better, possibly.
trying to find the right type of mattresses or pillows for you?
I think it's probably a bit underrated, but I think the problem with this is you could end up spending thousands of pounds on a mattress and then it's not helping for you, it doesn't help you. So I'd be a bit cautious, but I think it is important. That's one of the things, is about having a bed that's comfortable and a pillow that's comfortable. So I think it is probably underrated, but you can end up spending, like, mattresses are expensive. So I think, you know, nowadays actually you can get mattresses. I got my daughter a mattress that you can trial for 100 days. So if you don't like it, you can send it back. So that was quite useful. So I think, you know, I'd just be cautious, but I think it is important though.
Yeah, great. This idea, this kind of old adage of sort of counting sheep, how useful is that?
Yeah, I don't think, when I read about this, I don't think it's that useful. I think it is a bit of a wives' tale. I think I did read somewhere that they did study this and actually it didn't benefit that much. But what you're probably better doing is think about something that helps relax you, like a beach, a waterfall, somewhere you want to be that is relaxing. And I think I did read that that actually can help you get to sleep better more quickly than counting sheep. So I think, yeah, overrated, I think.
Okay. Hot drinks, milk, Horlicks before you go?
I mean, I'm guilty of telling patients to do this over the years. I think it's debatable. I think one thing about milk is that it has amino acids, proteins in that can help, that tryptophan in it has, which helps the production of serotonin. So serotonin is what is like the relaxing hormone that your brain produces. It helps make you happy and stuff. So I think that's probably where it's come from. But I think how much of that is in milk is debatable, and how much milk you'd have to really have a boost in your serotonin, you know. But I think it can be useful in part of a kind of a bedtime routine, a calming bedtime routine. And it's important not to have, you know, eat too late at night and stuff like that. But I think it can be part of a routine. So I think it's probably overrated, I would say.
Okay. And then having a window open. This is something my wife is always dead keen on. Let's put the window open. Doesn't matter.
So I think with the window open, it's why are you keeping the window open? So if you're doing it to keep your room cool, so that's important, because having a cool room is, so they actually recommend about 18 degrees for a bedroom, which is actually quite cold. I don't know if people have had children, you've got a thermometer in the room. 18, that's what they recommend for a baby. 18 is actually, to me, that's cold, but that's what they recommend. You need to have a cool room. So if you're doing it for the right reasons, I think it's important. But obviously keeping windows open, like where I live, we have bats, so the bats come in the bedroom at night, so I wouldn't keep a window open. But and also you need to make, it can be more noisy, so in the morning, you know, if you live somewhere really rural, it's probably fine, but it can be noisy, so you need to make sure that it's not waking you up early in the morning with traffic and things. And also safety, you need to just be careful, like if you live in a bungalow and nobody's come. So, but yeah, if you're doing it to make your room cool, I think it's a good idea. So I'd say underrated probably for that.
Yeah, no, that's interesting. I didn't realize about the temperature, but that's a really important point, that a cool bedroom is going to help you to sleep better potentially. And then sticking to a routine.
Yeah, so I think this is definitely underrated. So this is really important, I think, because they even say on the weekends you should set your alarm clock to wake up at the same time you get up in the weekdays. Because if you start, I mean, I'm guilty as a, you know, I like to have a lie-in on the weekend if I can, but actually the thing to do to help you in your whole week is to get up at the same time each day, go to bed at the same time each day. And that's supposed to be good for your quality of sleep as well. So yeah, so it's important, but it is hard, you know, when you've had a busy week and you want to sleep in at the weekend if you can. So, but yeah, underrated, I would say.
Brilliant. Well, that's all of those. Thank you for going through those. I think there's some really useful bits on there. And we were chatting just before we came on about the routine and the weekends and our new puppies that are keeping up in the mornings, which but helping to keep a good routine. So just on routine, then, just we've got a few questions just that have come in that kind of link to that, and particularly about working shifts and days and nights and that challenge around routine.
Yeah, so shifts is difficult, yeah, because I know it's well known that shift workers have a higher risk of cardiovascular disease. So they have so it's well known that shift workers, the mortality, it can affect, your health problems.
Yeah.
I think shift working where you have a regular, if they have a regular shift, that's easier to deal with because then you can get a routine. Whereas I think the shifts where you're chained, one day you're doing these hours, the next day you're doing different hours, that's harder to deal with. What I'd say about shifts would be is I think it's a bit debatable about what to do with shifts. Some people say go to bed straight away when you get back. Some people say have a little nap, then have your proper sleep sort of shortly before, like in the hours leading up to when you're due to go back to work. What I'd say is obviously keep your caffeine down, when you're at work, keep your alcohol down as well, like we mentioned earlier. When you sleep, because obviously a lot of them are sleeping in the daytime, so wear an eye mask, wear earplugs, to try and at least alleviate, try and get the light and the sound out and stuff. Sometimes having a hot shower before you go to sleep is important because actually hot baths and showers actually, strangely, they cool your body temperature down, so they're good to have before you go to sleep. So I would say there would be my advice really, but yeah, shift working is not great, I would say, but a lot of people have to do it. So
yeah, no, those are useful thoughts. You've mentioned a couple of things that might, taking a hot shower is a really interesting one. I mean, if you could, from your personal perspective, this is going to be different for everyone, but what could a good kind of bedtime routine look like for adults?
Okay, so I would say probably making sure you don't eat too late at night. So try and sort of eat at roughly the same time. So, quite a good few hours before you're due to go to sleep. So just at night time, you're not digesting food and getting indigestion and stuff like that. I'd say exercise early, like we said before, don't do it before bed. So a couple of hours before bed, I would say really start winding down. So with all this home working, don't be working the minute you're going to sleep. So you need to really start winding down, a couple of hours before bed, watch some TV, read a book. But reading is actually excellent, to help people to sleep. So reading a book, do some meditation even. I don't know if I'm a big meditation person, so doing some meditation is good. Even a bit of gentle stretching. So not exercising, but just gentle stretching and stuff before bed. Make sure your room is cool. Make sure you don't work in your bedroom. So don't be doing like online, like do your work in the corner. So make sure your bedroom is a place of sleep, really. Having a bath or shower, like we said, particularly a bath is good. It actually lowers your body temperature. That's good before sleep. Make sure your alarm clock, if you have an alarm clock with like an LED display, turn it away from you so that you're not like waking up in the night looking at it and stuff, or any other lights. TVs often have little lights on and stuff, so make sure there's no lights that you can see. So that they would just be some simple things I would say. Make sure your room is cool as well, and sometimes a dark room is quite good. I have a room in my bedroom that, not in my house, my husband painted like it's almost like black, and it's like the guest room. We're like, people are going to find this really weird, but actually people say they slept really well in this room because it's really dark. It's dark, so it seems to work sometimes.
Okay, no, thank you. There's some really great tips in there, certainly things that I've never considered. So I think we've probably covered most of the questions we wanted to cover there, Zeenat. Just before we wrap up, is there anything else that you felt like you really wanted to share today that would be useful for people to know about?
I think just that sleep is really important for lots of things, not just about feeling refreshed in the morning. One of the big things I wanted to mention actually was about sleep apnea, which I think we had a discussion previously about this. Is sleep apnea is a condition that can be quite it's where you sleep and then you kind of stop breathing almost, and you kind of so you have an apnea, it's called, where you almost stop breathing and you wake up kind of spluttering and kind of think, what's happened. And in the morning people feel very tired and things. So sleep apnea is really important to go and see your doctor about. You don't feel refreshed. It's very common in like Often the classic person is overweight, and often men have it, but women have it too. So it's really important to speak to your doctor or your healthcare professional. There's a questionnaire that we do called the Epworth Sleepiness Score. So it's about how quickly you would fall asleep in the daytime in different situations. But then you can get referred and get it investigated, because it causes loads of accidents, road traffic accidents. So it's something that you can get help with. They assess your sleeping and your oxygen level. So I think that's one thing I would say is, if you think you've got anything like that, you should go and speak to your healthcare professional, and they can get you help or assess you and decide what needs to be done.
Yeah, no, I think that's probably a really good point to finish on. Just that we've discussed some general principles, I guess, today, but if people have got significant problems with sleep and are struggling to sleep or spending a lot of time awake in the evening, then of course go and see your GP and get
because there's lots of things that they can help you with. Medication can affect sleep, so I think it's important that don't stop your medication or don't change things without speaking to somebody just to check it's safe, and they can advise you on what the best thing to do. And also there is help out there. If those simple things that I've talked about don't help, there are more significant things. I mean, the CBT, cognitive behavioral therapy for sleep, there's some good apps. There's one called Sleepio. One of my friends is a GP in the Lake District, and their area, CCG, actually pay for people to do this, if the mental health team or whoever advises it. I'm not sure if this area do that, but you can pay for it. But that's very good. It's like a sleep program that you can do if you have more significant sleep problems and things. But hopefully those things that lots of sleep. There's a lot of sleep apps as well, like they're not just meditation apps. Calm, 10% Happier. They're different ones that have helped. They have different things that can help for sleep. They're easy. You don't have to turn to the sleeping tablets or anything as well.
And finally, Zeenat, is there where if people want a bit more information or just to do a bit more reading themselves, is there anything online or NHS resources that are useful?
Yeah, there's a good, I looked on, so patient.co.uk is a really good website. They have loads of information about all sorts of things. You type in what you want to read about, and it's very well, they provide the leaflets that we often give to patients in surgery. So that's got loads of good stuff. The NHS website is good. That's got loads of good information about sleep as well, for teenagers, for adults, sleep. We call it sleep hygiene, a lot of this stuff we discussed. So it has loads of good techniques and stuff, and then other places you can get help if you need to as well.
Brilliant. Well, thank you so much for joining us, and thank you to everyone who's listened online this morning or will watch later on. I think that's been really useful, Zeenat. So thank you for your time. We know how busy.
Thank you. No, thank you for having me.
And we'll be back next week with our next podcast. So thanks everyone, and have a great day.
Thank you.